you know, there's a lot of political considerations I know that the states are dealing with. I think that there's a surprising degree of planning going on, even in states that are not highly visible in their activities. Because I think even there's a very interesting option being offered. So there's the state-sponsored exchanges, there's the federally facilitated exchanges, and then there's a partnership model. And I think that's a very interesting model where a state that's not in a position to go all the way to run its own exchange can work in partnership with the federal government to do pieces of it, and with a view to eventually transitioning over time towards taking on full responsibility for running the exchange. So I would say to states that are, you know, not ready to do the whole 9 yards, that they should think about the partnership model. There's a lot of interest for state insurance departments in making sure that there's not a conflict between what they do as state regulators and what goes on with the exchanges. And I think a natural partnership model would be around plan management, where the state is really taking on that role of qualifying plans, looking at solvency and those sorts of things. And there's a quality piece absolutely there in the qualification. So that's what I would say is you don't have to do the whole thing. You can start on the path, and you want to be able to do what, not create sort of a mishmash of signals to the marketplace. I think you want to have a real concerted set of signals to what you want the individual market to be, as well as the small business market. I think they can. I think I mentioned earlier that if the states set up these exchanges as really being competitive with robust competition among plans on quality and cost measures, and where that information is translated effectively to consumers, potentially through the navigators, which are groups of people who are helping people enroll. And I think we can't expect consumers to know that much about healthcare. In fact, a lot of the research that's been done shows that they really don't know much about benefit design, cost sharing, and certainly quality measures is something that they are only dimly aware of. But these navigators are a really great potential way to help consumers be the engine to drive competition among plans based on cost and quality. And so I think states can, in that role of setting up the navigators, setting up the web portals that consumers will use to choose plans, I think those are some of the key tools to help drive competition.